Ta-da! All right, today we're going to do the CERT medical review. This is presented by the Hayman Park team 2021. Ashley St. Cyr and Michael Groden as the main speakers today. So thank you all so much for coming here. Let's see, how do I do the quick? There we go. So today's agenda, let's do a quick talk about Zoom polls, which we're going to be using extensively today. It'll be good practice for using them. And we'll go over viewing Zoom on our screens. So let's start with that. So for instance, when I hit share screen, if you now can't see anything else on your screen other than this screen and you'd like to see your tabs still, if you press the escape button, or for some of you, if you even just click with your mouse in the middle of your screen somewhere, it should minimize things back out so that you can have more, you can actually do other things, see other things on your screen other than just this. So feel free to play with that. If anyone has any issues right now with viewing the presentation or anything like that, please speak up now so we can square you away.
You're the first presenter that has ever said, hey, if you want to do something else while I'm presenting.
Touche. But can you see us? Or I'm just curious about the.
I can see everyone who has video on right now. So that's a couple people don't, but.
Do I have video on?
Yep.
Oh, there I do. Okay. Just curious. And how would I see?
We can see what you're doing. Don't go off and cook dinner or something or cook lunch. Yeah.
Nope.
All right, cool. So we've got that squared away. Now for answering polls on Zoom, at certain parts, we're going to have little screens pop up that have a question and then a couple of answers. You can only have one answer, so they all have to be pre-made. So if your answer isn't on there, I'm sorry, do the best one that applies to you at the moment. But you'll just click with your mouse or your finger if you're on your phone on whichever one answer you most relate to, and then after like 30 seconds or however many, it tells me when everyone has responded. Once the majority have responded, we'll see the results and we'll move on to the next thing. All right, so we'll have a practice one in a second. So just stay tuned for that and we'll go over it. All right, then we're going to have a roll call, quick gear check, doing a quick little Zello practice, triage review and practice. Michael will be handling that part. We'll do a thing with a video tour of the ARC for any Hayman Park people who are here, what to do in case an emergency happens, review, and then we'll talk about our pep bites and logger training hours. So we might change the order of some of these things because since we have the majority of non-Hayman Park people here, I want to make sure that we get the pep bites, a couple of these things said before you log off. So stick with us and we'll see how it all goes. If you have any questions during this presentation, if you move your mouse around, you should have a little, your bottom of your Zoom window should pop up with things like chat or reactions or whatever. Feel free to open up the chat box and put a chat in there. Put your question in the chat box or write it down on a paper next to you. And then at the end, we'll have a chance to ask questions, okay? So let's start out with the A and B clear medical kits. This was more for the Hayman Park people. So of the Hayman Park folks, Jessica, did you ever get an A and B clear medical kit from Isabel?
No.
Okay.
I didn't
cool.
know about it.
Well, we're just going to move past this because it doesn't really matter when no one here is Hayman Park. So this was going to be the practice Zoom poll. So let's all just use this as our group practice for how to do a Zoom poll. All right. So at this point, do I do the poll or do you do the poll, Michael?
You can go ahead and do it. Do you see
poll
down there? I have to
minimize my screen in order to do it.
So you see polling? You want me to do it?
Yeah, if you could do it, that'd be great because I thought, yeah. All right, everyone should have a little window that popped up.
There you go.
And it has the question. And none of these answers are going to really apply to you. So just say, or the answer if I have neither is completely accurate. Just to practice hitting the button.
Oh, I see. Okay, cool.
Cool. 9 of the 14 have voted so far. Wow, this is cool. It gives you real-time updates.
I've never done this particular, and I've done zillions of Zooms. I've never done this.
Yeah, Michael brought this up as something we could do, and I was like, oh, this would save a lot of time of talking. All right, we have three more folks who need to just press a button to move forward. Probably myself too. Do I have to click one too? No, I don't click one. 12 of 14, 2 more. All right, I'm gonna end the poll, but the majority of you figured it out, and the other ones maybe decided they were gonna go heat up their coffee. All right, so at the end, if we want to, we can share the results. You can see the results where the 12 of the 14 folks who responded say they have neither. So that's great. So when we do more Zoom polls later on in this presentation, it'll be similar format. All right.
Very interesting.
Gear status check. Do you have, and then you don't have to show us your stuff, but just do you have your CERT backpack, your, oh, that's blocking everything, personal go bag, your family pet go bags. This is another time for a Zoom poll. If you could bring that up, Michael, please.
Well, every year I
Oh, hold on, Jessica, if you could do me a favor, we're trying to, everyone, if you could mute yourselves if you're not presenting, and then if you have a question, you could definitely type it in the chat box or wait till the end, just in the interest of moving along. Thank you. Is the Zoom poll?
There we go.
There we go, cool. And this applies to anyone in CERT, so you don't have to be in Hammond Park to answer these questions accurately.
And there are 3 questions, so you'll have to scroll down. All right, a couple more seconds. 11 out of 14. Ashley, you ready?
Yes.
I'm getting a, can I ask a question? Janet is asking how to get in.
Yeah, I'm texting her right now that she didn't register on Eventbrite to follow the email I sent out yesterday with the link, and yeah, thank you, George. All righty, 12 of 14. All right, I think we know who's warming up coffee still. Awesome. So great, this is awesome. I love your answers. We do have the average amount that I would expect, needs some work, but almost there for most of these, and that's totally fine. This is our wake-up call to add this back to our to-do list for the month of March to get this done, right? So, all right, I'm going to get rid of that. Perfect. All right, let's do a little Zello. If anybody on here has Zello already on their phones, if you don't have it already, please ignore this part. But if you have Zello on your phones, please open up that app, find the channel that is right here on the screen, Campbell, without the quotation marks though, Campbell CERT Hammond Park channel, and capitalization does matter. And I want you to send me a simple, hey there, or what up, or hi, just to show that you're getting familiar with using the app.
Yeah. Oh, hey, George, I don't know how to get to Zello that you helped me with from my cell.
All right, we'll go over that later then, because I just want to make sure that we're.
Sorry, I have it. I
It's
don't
okay.
know how to get.
If you know where your apps are in your phone, that has all the apps that you've downloaded, it should be
Okay.
right there at the end of the list.
And then
where
I
it says
lose
Zello.
you. Well, not lose, but okay. I'll go up.
Yeah. And then you look up the.
Back to meeting. Now I lose you. It's.
That's fine. That's fine. Just send the message. Send the quick little text message. And I am looking for a text message, not a verbal. So try to go to the little chat window and send a little.
I can't get to the apps. They're not letting me. I'm.
Okay. Yeah. If you're on your phone for Zoom, it might not let you.
Oh, it's not letting me.
Okay. No worries.
Well, that's not good. Okay,
Well, I mean, presumably in a disaster, you wouldn't be on Zoom the whole time, so it'd be okay.
all right, I'll go back. I'll mute myself again.
You're good. You're good. All right, so I've gotten a couple of messages. That's cool. It might be everyone on here who actually has Zello, and that's fine. Heyman Park is kind of trying to push Zello as one of the ways that we can stay in touch if the radio goes down, or if people can't access their radio in the moment and they still want to get a hold of folks. You can either text message or send a message on Zello. So here's the Zoom poll for the Zello questions. That'll pop up in a sec.
Okay, there you go. Please answer.
Awesome. Thank you so much.
A few more seconds. We're going to shut it down.
Sounds good.
I don't like these answers.
Have a good one for I'm using it.
That's true. The one answer should say, yeah, I'm good to go. Sorry about that. All right, cool. So then we probably got all the answers we needed to get on that. All right, awesome. Thanks, guys. Boom, boom, boom. All right, now we'll go into, let me make sure I didn't miss anything. Yeah, let's go into Michael's section of triage and all the fun there. I will mute myself and stop sharing my screen. And take it away, Michael.
Close the poll. Michael, you're still muted.
There we go. Everybody hear me?
Yeah, we're still looking at the poll.
All right. The poll should be closed.
Oh, there. Now I just hit the mute button and up showed the slides.
All right. Did the poll close?
It says that I'm viewing your screen and it's still open. So let me just try to, I'll press the little X button in the corner of the poll.
Well, I've closed the poll.
I don't see it anymore because I hit the X button in the corner of the poll
Okay.
screen. Is everyone else squared away?
All right. I'm
Good
going to
to
move
go.
on unless people scream. Okay. This is a review of what we learned in our CERT Academy way back when. For some people, it's several years ago. Others, it's more recent. One of the tragic things is the new CERT curriculum. They've removed triage. So we're trying to keep up on it. It's an important skill to have. So let me just jump into it. All right, so triage, it's a French word meaning to sort, and triage is a skill that we can use virtually anywhere. It can be in the mall, at a sporting event. Basically, triage is used anytime the number of patients exceeds the number of providers, and that means you have to make a choice. When you come in, you have to decide who you are going to treat first and how you're going to treat them. And the purpose is to save as many lives as possible and to go as fast as possible and to stage patients so that they are in nice, neat piles ready for transport. So the first thing we do, and everything, we do this for everything in CERT. We got to make sure that our BSI, that we've got gloves on. Gloves are important. Eye protection, N95 mask. If you are doing triage, if all you have is the medical mask or these cloth masks we've been using for the last year, if that's all you have, that's fine. But in a case where you are doing triage, especially after something like an earthquake, where there's buildings have collapsed, there's dust, you really want an N95 mask. So we've we want to make sure we have those in our backpack. We need to make sure that the scene is safe. There's no visible hazards, that we don't smell anything. You got to make sure it's safe for you. And before you jump in to doing triage, you want to call 911. If it is an earthquake, 911 is going to be incredibly jammed up. So you might want to call the 10-digit direct number, the 408 number for your city. Each city has a 10-digit number. I can share those after if you guys are interested. All right, so we
Yes,
break
Michael.
people up. Yeah. Question?
Oh, no, just yes, please share the numbers.
Okay, I will later. So we divide people up into 4 categories: red, yellow, green, and black. Let me go over the categories first, and then we'll talk about what to do with them. So priority 1, the red folks. We remember the 32 can do. 30, that is the respirations are greater than 30. That means they have breathing difficulties. They're not getting the air that they need. Perfusion, that's the 2 of the 32, that if they have a severe bleed, it's likely that their perfusion is going to be very low. And we remember how to do that. We press on the nail bed, and it should go from pink to white to pink. Also works inside your lip. Also works inside the conjunctiva in your eyeball. That red part underneath your eyelash works there. So the 30 part, there's only 2 things we do. There's only 2 medical actions we take when we're doing triage. One is for airway. We reposition the head so that perhaps if their head is bent over because of whatever reason, they may not be able to get breath. So we would reposition their head, open the airway so that they could breathe. We would do that 2 times, attempt to do it 2 times to regain breathing. The other thing that we would do when we're performing triage is to control a major bleed. Because if they are, if somebody has a major bleed, those have taken the Stop the Bleed class, and we'll review that in a few minutes. We know that you can bleed out in just seconds. So we want to control major bleeds. So repositioning the head and stopping major bleeds are the only thing that we can do. We do not do CPR when we're doing triage. So that's the 30, the 2, and the can do. The can do, we tend to gloss over that. It doesn't seem really significant. But if somebody has a major bleed and they're not getting oxygen up to their brain, then their mentation starts to diminish. They aren't able to think. So asking simple questions: where are you? What's your name? What day is it? What happened? If people can't answer simple questions, if they're not there mentally, that's a very serious problem. So these piles of people are going to fall into the red. Pregnant are always a red if a pregnant woman is injured. And then hips and femurs, those are always a red because we can lose huge amounts of internal blood and serious bleeds. Questions so far? Holler up if you guys have one.
What about for burns, if there's potential to airway burns, in other words, smoke around the nose or mouth?
Absolutely, that's going to be a red. Smoke around lips, black around the lips, burns on hands and feet, circumferential burns. And that's why hands and feet, because they can, as it starts to cool, it starts to constrict, which can cause further problems. And then burns in combination with any of the other things above. Thank you for that. Other questions? So normal is adult is respirations of the this is the 30 part, 32 can do. Respirations, if normal is 12 to 20. Breathing too slow is just as bad as breathing too fast. So we look at respirations for a quarter of a minute, 15 seconds. And if there's more than 7 or less than 3, that's a problem. That's going to make these people red. Perfusion, talked about that. It's going to go from pink to red, pink to white to pink. If that takes more than 2 seconds for the pink to come back, that's a problem. That's going to make them red. If they have nail polish on, if it's really cold out, these are going to be things that can slow perfusion naturally. Well, nail polish doesn't slow it, but then you're going to have to go to the inside of the mouth or the inside of the eye. You have to be cautious in doing that. If you're looking in people's eyes, if the situation is unstable or they move, you can poke them right in the eye. That could be a problem. If you're sticking your finger in somebody's mouth, that's like sticking your finger in a mouse trap. You could get bit, so be cautious if you're going to do that. We talked about this a little bit. So talk to the person, ask them simple questions. Do not ask them yes or no questions. Do you know where you are? Yes. Well, that doesn't really test their mentation. Ask them, where are you? Where are we? What happened? What time is it? Who's the president? Ask them questions that you suspect they will most likely know the answer to. And if they don't know those questions, if they're unresponsive, if they just don't know what's going on, that makes these folks a red. So let's practice that for a second. The easiest way to check for respirations is to watch for chest or stomach rise and fall. If it's outside, or if and they're wearing a lot of clothing, that can be difficult. So what you're going to want to do is you're going to want to place your hands or fingers on their belly, and you're going to want to just push lightly. Be cautious if you are checking the respirations on a child and their parent is around. You have to ask for permission. You need to let the parent know what you're going to do, or you could get a parent really angry with you really, really quick if they see you touching their child. So you want to count the respirations. 3 to 7 in 15 seconds is where we want it. But if people are hyperventilating, you can usually tell that just by looking. We've all hyperventilated. We've all seen other people hyperventilate. When people are breathing really, really rapidly, they don't take in enough oxygen. So that's going to be a problem. So that's how we're going to check for respirations. Perfusion, talked about that. Any questions? All right, you guys are good. This is review, so I'm not looking for a lot of questions. Yellow are people that have been injured, that are not a red, that don't have life-threatening injuries. The respirations are okay, they don't have major bleeds, and they can answer questions. Their mentation is proper. They might be bleeding, they might have a broken bone. These are not life-threatening. Broken bones hurt like the dickens. There may even, a bone might even be coming through the skin. But if it's not bleeding too bad, then they could be a yellow. Green, these are people, these are, as you remember, these are our walking wounded folks. When we approach a scene, that's the first thing we're going to call out. If you can hear my voice, walk toward my voice, walk toward the door, come to me. Those of you that can hear me, get up and get out. These are walking wounded. These are people that have owies and boo-boos. Maybe they have major scrapes. Maybe they have, you know, a fairly good cut, but their arm is on it. These are people that can handle their own injury. You want to get them out of the situation so that you can then go in and have more room to deal with the remaining people. Remember, people that are walking wounded, these can be your helpers. These are people that can apply pressure to other open wounds. These are people that can get supplies. These are people that can help other patients. Black, these are people that are dead. These are fatally injured. They're not breathing, not responsive. So if they're not responsive, they're not going to be talking. These are going to be the people that if you saw a single individual, you're going to come up and likely start doing CPR. But we don't do CPR when we do triage. The reason is simple, because when you start CPR, you finish CPR. You do it for a long time. And the idea of triage is 20, 30 seconds per person. You are going from person to person, sorting them to see how they're doing, to making sure that you've got them categorized in the right category. So we don't do CPR because that takes a dedicated resource. However, I said we've got walking wounded. If a walking wounded knows CPR and they are able to, that would be an acceptable use. So we don't take more than 30 seconds when we do triage. We label each person. They have that triage tape. That's the bottom left corner. These are different tapes. They're like masking tape. There's no sticky on them. You just pull off a large chunk. You tie it around a wrist or an ankle with the color relating to green, yellow, red, or black. We also have these in the middle are wristbands. And then on the right is a triage tag. Those are more common. You wouldn't immediately fill that out. You would attach a triage tag to somebody's clothing, preferably not the clothing where an injury might be. So if they're injured on their chest, you would attach a triage tag perhaps to their wrist or to their pants, not to their shirt. When you have a triage tag, you tear off those little strips on the bottom, the P3, 2, or 1, to indicate where they are. So if they're a red, you tear off obviously the yellow and the green, and you leave the red. Then you, once everybody's labeled, you want to sort them by color. And this is actually more important than you think. It's not just because we want them sorted for convenience sake, but it's because we're actually preparing for transport at some point in this mass casualty incident. People like Ashley, wave Ashley, oh, Ashley's gone. EMS will roll up, the ambulances will be there, and you want the ambulances to be able to all come to the same area. You don't want to be sorting through your piles of people, having gurneys have to go around different people to get to the most critical, which are the red. These are the, yeah? These are the people that need immediate transport, so we sort them by color. Then once everybody gets sorted, that's how we prepare for transport. Then we go back and we do it again. Because people that are, even people that are green, even the walking wounded that I feel fine now, they might have had a bone, perhaps a bone break, an internal bone break, and it started some internal bleeding that has now caused other problems, and they pass out. So you need to go back and check every single patient. Start with the reds, go to the yellows, go to the greens. You go and reevaluate them. And when you are reevaluating, that's when you have time to get the greens to come in and fill out the triage tags. If you don't have triage tags, hopefully you have in your kit the 214s, you can use that or use blank paper. Fill out something to gather the information. Gather vitals as you go along. Every time you go around, you want to gather vitals. Out in the field, there's a couple of vitals that we can gather without any other instrumentation. That's pulse and respirations. We talked about respirations a few moments ago. Pulse, you can take it on their wrist, you can take it on their neck. It doesn't matter what their pulse is other than you are just writing it down, because what you want to do is you want to get trending vitals, because this is part of your preparing for transport. You are going to give that information to EMS when they show up. So for example, if you see that their pulses are normal and they start to go way, way up, this is information that EMS can use, because that's an indication that something has changed within the patient. A parent and child always go as one unit. We don't separate children from parents. So if the child is yellow and the parent is red, they both get transported as red. So I'm going to stop right here for 1 second. Are there any questions? Because we're about to have a quiz, folks.
One quick comment, Michael. If they have no triage equipment and they do have a marker, they could mark on the forehead YRD.
Oh, excellent. Yeah. Thank you, Mike. Yeah. If you happen to have, if you're prepared with your Sharpie, that would be great. Ballpoint pen. Yeah. Mark right on their forehead. Any other thoughts? All right. So we're going to watch a series of videos. After each video, we're going to have a poll, and we're going to go on to the next one. So the videos are they're 20 seconds or so. Take note, figure out what the problem is. I'm going to give you a poll. I'm going to leave that poll up for maybe 10 seconds or so, because I want to put a little pressure here. We're trying to go fast, because the idea of triage is 30 seconds per patient. So I'm not going to go back. So, you may miss one. That's okay. But we're going to practice. Remember, it's 32 can do. So let's watch these videos. I hope everybody's, well, I know you can hear me, so you'll hear the audio. Let's go ahead and do it. Here's scenario number 1.
I can't hear. I can't hear. I can't hear what happened. I don't understand. What happened? What hurt? I can't hear anything. I don't know what's going on. What happened? What happened? Yes, no. I don't understand. Tell me what happened. I don't understand. I don't know what's going on. Please help me. I don't know what to do.
Okay. Let me get my poll here. Where's my, oh, here we go. All right, you guys ready? Here we go. Was this lady red, yellow, green, or black? It's good. You guys are doing this quickly. Okay, I'm going to stop it. Write down on a piece of paper what you said, and then we'll come back. Okay. Well, actually, let's do it this way. We'll do it as we go along. Half of you said that it was red. Half of you said that it was yellow. Anybody want to chime in here why they voted the way they did?
Can't follow instructions because you can't hear.
That's right. She's not responsive. She doesn't know what's going on. Exactly. Okay. Let's continue on. You guys could hear that okay? You could see the videos. That worked well. It's the first time I've done that. All right.
So are you, Michael, are you going to tell us if you would have judged it red or yellow?
Oh, thank you. Yes, that is a red because she was not responsive. She was not able to answer questions.
Okay, thank you.
Okay. Here we go, number 2.
Sir, can you hear me? Sir, talk to me. What's going on? Stand still, okay? Look at me. What happened? You know what happened? What's your name? Anything hurt? Can you have a seat? Have a seat for me.
Okay, that was an interesting one. Notice he was able to follow directions, maybe. All right, let's. Okay, here we go. Number 2. Wow, you guys are fast. Good. Okay, that's right. This man was also, he was non-responsive. He was able to follow directions. He was able to sit down when he was asked, but he was not responsive. He was not able to answer the responder back. His respirations were good. His capillary refill was good, but he was not talking to the responder. Dazed and confused, call it what you like. Unless he is able to talk to the responder, this is where the problem lied. So this man is a red. Okay, let's move on. Number 3, here we go.
Sir, can you talk to me? Sir?
Okay. That was number 3. All right, what was this guy? Okay, new record. We got 15 out of the 16. Excellent. Anybody, what was this guy?
Dead.
Dead. Why was he dead? I mean, what 32 can do? What gave you that hint?
No pulse.
No pulse, no respirations, not responsive. That's right. That man was clearly dead. Okay.
All right, sir, what's bothering you?
On my leg, sir.
Okay. Take a deep breath. Your leg hurts you?
That's my leg.
Is there anything else hurting you?
No, sir.
Okay. What was this guy? Okay, anybody want to share their thoughts? Is he red or yellow?
He's yellow
And why is that?
because he was able to respond. His he was breathing, his capillary response was good, but he obviously couldn't move. So
Right.
he wasn't green, but he's yellow.
Exactly. He was injured, but there was nothing there that led us to believe it was life-threatening. That's right, exactly.
He said his leg was hurt, but my brother broke his femur. If he had broken his femur, which would have made him a red, his pain scale would have been far past 10.
Very true. And that's an interesting point because a femur, you can lose a liter to a liter and a half, almost 20% of your blood in a femur break. And after a minute or so, that loss of blood mentation would have started to diminish too. So those are tough ones. That's why we go back and reevaluate. Thank you, Mike.
Sir, can you hear me? Can you take a deep breath? What's bothering you? What hurts?
Okay. Okay, anybody want to tell us what they thought for number 5? Okay, I'll give you number 5 is a red. While he was not responsive, he was alive. He had respiration, so he was breathing. His capillary refill, while slow, he had capillary refill. It was higher than the 2 that we like. So that man is a red. I've got a couple more of these. Do you guys want to keep going? Are we enjoying this? Yes, no?
I think yes. I think this is helpful.
All right, because we're 5. I've got 9. We can do them. They're going pretty fast here. All right.
Hello, sir. You talk to me?
I don't know what happened.
You don't know what happened? What's your name?
I gotta go home.
You gotta go home? What hurts you?
Where am I?
Remember what happened?
I gotta go home. Get home.
What hurts?
What happened?
All right, there's scenario 6. Okay. Anybody want to say why they think this guy's a red? Okay. The man's a red. He was not responsive. He didn't know what was going on. He wasn't able to communicate with the provider. His respirations were high. They were 34. They told us his pulse was way off the charts, and his perfusion was very slow. So this man was clearly a red.
Hi, sir, what hurts you? What's bothering you? Can you talk to us? Okay, take a deep breath. All right, we got a perfect score. Yeah, that guy was clearly a red. You guys are doing well. Good job. All right, sir, what hurts you? What's bothering you?
Get this off of me. I'm stuck under here. Get this off of me.
Okay, do you know where you are right now?
What happened? What happened? Get this off of me. Get me out of
What
here.
hurts you? What hurts you?
I'm fine. Just get me out of here. What happened? What's going on? Get me out of here.
Okay, let's have some discussion here. Somebody tell me what they think here. This will split right down the middle between red and yellow.
It seems to me that there is some confusion about, and it's a natural confusion that I think happens every time we talk about triage, between when we talk about 32 can do. If the person doesn't meet any one of those three main criteria, they're pretty much going to be red. So that's a really good rule of thumb, I think, to remember when we're looking at these, is that, are they around 30? Okay. Are they around 2 capillary fill? Okay. Are they can't do? That they're going to be a red, right? So I just want to throw that out there. And if anyone else had some that still has real strong feelings that this person's a yellow instead, please share, because it's good to have discussion on this.
I thought he was yellow because even though he didn't respond to the question, he knew he was trapped. He was clearly aware of the situation. And the fact he's not listening to you if he's being trapped, to me, he doesn't say, oh, he's not following my instructions. He's trapped, but he's stable.
Mike, that's a really great point. But to Ashley's point is that this is a tricky one, because he sounded like he was fine. It is better to err on the side of caution in this case. The man was talking, he did know where he was, but the provider was asking him other questions. And while he was singularly focused on just saying, that he's trapped, he did appear confused. And so that alone is enough to make him a red. So there's no harm in making him a red, because we can always reclassify him as a yellow once we get the situation under control. But better to tag him as a red, because there could be internal bleeding or something else going on that we just simply can't see.
And this scenario actually reminds me of the first one with the lady who couldn't hear from the blast. And it's very similar because maybe in like the next 15 minutes, her hearing's going to start coming back, or this man is going to start coming back to his senses, and we'll be like, oh, you're clearly a yellow, or look, you're actually a green now. Great. So the reclassification, it's kind of a good reinforcement that we're not going to just do this one and done and say, oh, you were red at first, so sorry, you're stuck there. Or, oh, you were a black at first, you're sorry, you're stuck there. If these
Right.
people, the body is an amazing machine, and sometimes it can reboot itself.
That's right.
And what,
Thank you.
what was
Yeah.
the pulse, Michael? Or, yeah, what was the pulse?
Was this the one where it was 138? I don't remember. It was very high.
It was extremely high, I thought.
Yeah.
I'm
Yeah.
working on a cell here, so I didn't know. But if that, just that alone, would that have made him a red, I thought?
Our criteria is 32 can do. We look at respirations, perfusion, and
Right.
mentation. So
Right.
if his pulse is really high, other things are going on, it might just be, you know, when we get scared, our pulse goes way up. So a pulse alone is not an indicator.
That's what I need. That's what I was curious about.
Yeah.
Mike, quick question. If someone's trapped like that, and shouldn't you wait for the fire department if somebody don't relieve that pressure, because then they could bleed more internally, that you should wait for help?
That is not the scope of this class, but the answer to that's going to be yes. We don't necessarily want to lift that axle up off of his legs, because it could be constricting blood, starting compartment syndrome, in which case when we relieve the pressure, it creates other problems. But that's not what we're just learning to sort here in this class. Okay, let's do our last one.
Ma'am, can you talk to me?
Yeah,
What's your name?
Debbie,
Debbie, what happened?
I don't know, there was an explosion.
There's an explosion? Where hurts?
My chest and my abdomen.
Your chest and your abdomen? Take a deep breath for me.
It hurts.
Okay.
Hmm.
Okay, anybody want to tell us their thoughts here?
She couldn't move, so she wasn't going to be a green, but for everything else, her breathing, her capillary response, her ability to answer questions, she was good. So, but she was clearly injured and unable to move, so the yellow.
That's right. She and how she got stuck under the car, and with this whole discussion of compartment syndrome again. Do we want to move her from under the car? That's a different discussion. But yeah, at that point, she's going to be a yellow.
My question is, did I read that the pulse was 100?
No going back, Jessica. Don't know.
Okay, never mind. I just thought it was, okay.
But even if it was 100, Michael, on the last scenario, he said that pulse rate alone is not an indicator, right? It's
Okay.
the
Right,
respirations.
yeah.
That's been my downfall.
capillary
Okay, thank you.
refill, And yeah, it's the respirations, the capillary refill, and their mental status, if they can or can't do.
Okay, sorry.
The
Thank you.
respiration, I think, was 20 per minute.
Okay, yeah, it was 20 and the cap was 1.5.
Oh, I read it wrong. I'm on, never mind. Thank you.
Okay, so so we've gone through, we've evaluated these people. As Ashley points out, we have to go back and reevaluate them. Even the green, even the folks that are up walking around, we need to check in with them and make sure that they're okay. Use the green to go back and evaluate other patients. Even though they haven't been trained in that, they can go and talk to these folks. As we've learned, mentation is a huge indicator of whether they're going into the red. So have your greens go talk to your reds, and if they can't follow along, if they don't know what's going on, they stay a red. If they talk to the yellow and they too don't know what's going along, then flag somebody that's doing the triage and get them reclassified as red. So that's relabel as needed. Update the vitals. Again, you can take a pulse, you can take respirations, you can do that in the field. Once you've done it, you just got to go back and keep doing it, keep doing it, keep doing it. As you sort, you want to put your red closest to where the access is for EMS. You don't want the red to be way back on the way back in the middle of the park. You want to have the red area, the red staging area, close to the street, because that's where the ambulances are going to show up. So it's about saving the most number of lives as fast as we can. It works. Ashley, do you have any triage story you want to sprinkle in here?
You know, I haven't had an MCI to this point in my career. So for those who don't know, I'm a firefighter in Daly City, and I live close to Hammond Park. So, so that's why I'm in this group right now, and that's why he's asking me about triage and MCI experience.
It is. Okay. That's all for the triage. Ashley, you've also got me doing Stop the Bleed. Are there any remaining triage questions?
I have a couple questions.
Yeah.
Just two questions, if I may. Yeah, and thanks. That was really good. The going through those scenarios, but in a couple of the scenarios, the patient, the person did not have a pulse at the wrist, but did at the neck. So I'm just wondering if is that fairly, common, or does that happen a lot, or is that pretty unusual?
Yes, the farther you get away from the core, the harder it's going to be to find a pulse when things go sideways. So if somebody has a weak pulse, it's going to be harder to find it on their wrist than on their neck, because the neck is just inches from the heart. The carotid pulse is easy to find. It's a very, very hard pulse. I mean, it's very strong. It's easy to find. That's why when we do CPR, we go right to the neck, because you can just always find it. It's a little bit harder to find it on the wrist. So good question, Mike. Any others? Are you?
Yeah, just one other one. Yeah, real quick. And
I also
I don't know,
say that the pulse at the wrist, though. I'm sorry to interrupt, but also if somebody's going into shock and their body is starting to shunt blood away from areas that are not the vital organs, you're going to lose your pulse at the wrist as you go into the later stages of that shock. So if they at least have a carotid, that they have, they've still got their heart going, which is good. If they don't have it at the wrist, it may be because they're getting deeper into shock. If they at least have some kind of a pulse at the wrist, that their blood pressure is going to be like the systolic number is at least still okay. So that's another thing. It's the clue to shock as well. Sorry.
That's excellent. Mike?
Thank you.
I have a comment.
That was helpful. The one other question I had, I don't even know if this is a question or just a statement, and it kind of came up in my original CERT training a couple of years ago. These are situations that hopefully we'll never be in, but very seldom. And, we're lay people, most of us, not healthcare workers. And in terms of, somebody labeling somebody in the black, as I said in the training, if it's, there'll be some obvious cases where, but I think for the most part, I would be so reticent to ever label anybody in the black if I had any slightest doubt. And I know when the regular healthcare workers get there, it would take them seconds to figure that out for sure. So I don't know if other people have any thoughts about that, but I just wanted to throw that out there. And thank you.
All right, good comment. Any other questions or comments?
I have a comment.
Yeah, Dan.
I think there's a tendency to put too many people into red. And if you've got, and there's such a difference can be such a difference between people who really shouldn't be read and people who really should be read. So you get maybe too many people jammed into red.
Perhaps that's why we go back and reevaluate as symptoms and signs become more evident. That will be, pardon me, that will help us to evaluate what category they go into. And better to make them red so that when EMS does come, if they feel they're a yellow, because they'll reclassify them, because you're right, they will be able to tell within seconds and move on to the next patient. So other thoughts or questions?
Just that if there is a severe bleed, there are the redder of the red, if you will. Just being prepared with ability to quickly slap on a dressing, and I carry this elastic wrap they use for exercising, so you can put on a really quick dressing pressure and move on. But if you're going to help those people, you have to have the stuff with you, quickly accessible, so you can do it.
Okay, then keeping on schedule, let's jump into the bleeding portion of today's activity. This is going to be a review. I'm going to try to slam through this in 15 minutes or so. This is not the full Stop the Bleed class. Many of you have taken Stop the Bleed, so this is just the highlights, if you will. There are 2 Stop the Bleed classes that are going to be coming up. They're not yet on Eventbrite, but they will be. One is May 5th. And the next one will be June 6th. So May and June, 5 and 6, Stop the Bleeds. You guys are all in CERT. You'll see those come across in the monthly calendar email. So if you want to take that class, I hope to see you then. Everybody can see my Stop the Bleed presentation, I presume. I'm going to go, yeah.
Yes, we're good.
Yeah. All right, so unfortunately, there's all kinds of places that we can use bleeding control. Severe bleeding is something that we all can do to help with. But now we're finding this, in the mall, at work, at school, at church. I mean, it's horrible. All of these other places where this stuff's coming up. But this is a skill that can, once mastered, well, not even mastered, once you have the rudimentary skills, you can become an immediate responder. So this is good that you're here to brush up on these skills. Like triage, like everything that we do in CERT, like everything that we do in EMS, our safety is primary. It comes absolutely first. If we're not part of the solution, we're part of the problem. So don't let yourself get hurt. Pay attention to what you're doing. Pay attention to the surroundings. Move to a place that is safe. If you're wobbling on an unstable surface, move if you have to. By all means, wear gloves. And what we've learned over the last year, you want to, by all means, be wearing a mask. I think now I can safely say that everybody has masks with them at all times. We don't have gloves with us. I encourage everyone to put them in every little crevice of every place you go. Put them in your backpacks, put them in your car door, put them in your glove box, put them everywhere that you happen to go. They're great to have. And they're good for arts and crafts. They're good for gardening. I mean, use gloves. First thing we do, like triage, like all things CERT, we call 911. We do that first before we dive in and get into the real mess of what's going on. In Santa Clara County, there are 21 agencies with almost 2 million people, over 1,300 square miles. 911 services a lot of people. they can get really, really, really busy. So it's good to know. Landline, that's that 10 or 11 digit number, with the area code, because in situations like earthquakes, where the 911 will become completely flooded, and you get that that tone, or worse, we've all had it. You're on your cell and you call and nothing goes through. Hopefully, the call into the 10-digit number will go through. I do have to mention that in Santa Clara County, as in now in most counties within the state, you can now text to 911. It's as simple as it sounds. There are situations where you would need to do that. If you are in a situation, an active shooter, and you don't want to be heard, you can text. Just remember that you've got to be patient with them. They're going to be patient with you. You're going to need to be able to tell them what's going on and where you are. They can 911, they can tell where you are on a two-dimensional map. They can tell that you are in the parking structure in front of Nordstrom. But our 911 service here in Santa Clara County, it is not able to tell elevation. So they cannot tell if you are on the second story or the third story right outside of front of Nordstrom. So before you call 911, you need to know where you are. This is not the time to play Marco Polo with the fire trucks. It's hard for those big rigs to make their way around these small parking structures, and you say you're out in front of Nordstrom. Well, there's 3 spots out in front of Nordstrom you can be. So know where you are before you call. Look around, look for landmarks, look for that big 2 on a wall. Look for signs that are all painted in yellow. Something so that you know where you are, so that you can communicate to 911. I'm out in front of Nordstrom. I'm on the yellow level. All right, that will at least get them closer to you. So know where you are when you call 911. So these are some of the same images you guys have seen before. Some of them are kind of gross. On the left side, we see an arterial bleed. This is blood spurting. It spurts with the beat of the heart. Every time the heart pumps, it pumps blood out through this injury. On the right side, which is equally as gross and disgusting, there's a whole lot of tissue shown. There's a lot of blood out on the material underneath. But I do want to point out, this is something that you need to pay attention to. Notice the bones up in the top of this. All right, those bones are all kind of cracked up and messed up. We're going to talk about packing of an injury. If you stick your fingers in there, there's a really good chance you could cut yourself on those bones. So I just want to point those out. So we have about 5 liters adults. I've used this before. Those of you that have taken my class, this is my bucket. This bucket is 5 liters. It represents all the blood in an adult body. If we lose about 2 liters of blood, that becomes a real problem. That's going to start to lead to shock, because if there's not enough blood circulating within the body, there's not enough oxygen getting to the organs. So that's why we talk about this. One of the things that we can do when we come to somebody in triage, where we stop major bleeds, because major bleeds cause serious mentation problems. Serious bleeds surely lead to death if they are not stopped. So Jessica, I'm pointing this out for you. Normal in an adult is a pulse is 60 to 100, pulse of 110, 120. When people are injured, when people are frightened, it is not unusual for the pulse to go way up. So pulse alone is not an indicator. You need to be looking for other things. So this discussion is about stopping blood. So we are going to be looking for blood loss in this case. So we got to stop the bleeding. That's why we do this 32 can do when we're doing triage. So we look for the source of bleeding. You need to find it. Hopefully everybody has trauma shears. These are those scissors with blunt ends on the front, so you can stick them right up clothing and not worry about poking people. These will cut through belts. These will cut through those big fat seams on Levi's. These will even cut through boots and shoes. These are really, really good tools to have. So if you don't have them in your kit, make sure you have them. So look for bleeding. If you can't see the injury, you may not be able to find the source of the bleeding. And bleeding, if it's a gunshot, for example, you might have two sources of bleeding. You might have the goes into and you have the goes outa. So you have to look for two sources of bleeding. When you have multiple sources of bleeding, you're going to go for the one that just looks the worst. Again, you're doing immediate triage, 2 injuries, 1 person. So that's triage. You have to go through the process of which one of these injuries is worse. Which one do I want to go to first? You do the first one, then you go to the second one. So you look for a lot of blood. That's always an indication. Pooling of blood. So you want to find where that blood is. You need to find injury. I'm going to pause right just for a moment. Any questions up to here? I know I'm going really fast, but this should be a review. So let me continue on. Oh, I talked about this. All right. Multiple sources and clothing. There's a few places that we can and we cannot deal with. When it's in the extremities, which is arms and legs, we can apply pressure, we can pack a wound, and we can apply a tourniquet. I will go over all those in a moment. But this is an important delineation because if it's in an armpit, the neck, the groin, we don't use a tourniquet. We apply pressure, we can pack a wound. And for the purposes of stop the bleed, while those of us that have more advanced training, there are things we can do for stop the bleed. We're telling you that if you have an injury in the core, we do nothing but cover it and keep it clean. And the core can be both the front or the back. And this is because we've got so many organs in there and there can be so many things going on. The application of pressure and packing internal to our core can cause more problems than we're taking care of. So to compress, we apply direct pressure. We've got this wound here on my arm. Let me turn around so you can see. So if I have a wound, we can apply direct pressure. We take gauze, we apply the gauze on, and we just push really, really hard till the blood stops. We put it right over the blood, right over the injury. And if the blood continues to ooze through, we put more gauze right on the top. We do not take off the gauze that we've already put on. That's really important because what little coagulation has started to occur by ripping off the gauze, you're basically having that wound start over again. So you put your gauze on and leave it on and apply pressure. If you don't have gauze, just about any other material will work. Preferably it will be clean. Dirty socks are okay, but clean socks are better. So just about any type of cloth you have around, napkins, clothing, you're probably, unless you're at the beach, you probably have a shirt on. that would make a great tool to put over a wound, okay? So put it on and apply pressure until the bleeding stops. If the wound is deep, let's see here, you guys can see this. If the wound is deep, one in which a finger, might go all the way in, we're going to pack that wound. We're going to put in gauze right inside the wound. So hopefully you would have hemostatic gauze in your first aid kit. If you don't, you'd use any gauze that you have, even those 4x4s, because what the objective is we're trying to get to the source of the bleed. So those arteries are deep inside of our extremities. So we're going to try to get the gauze, we're going to push it in and try to push it right down onto the artery. And just as I said, we apply pressure and gauze on a wound. That's the same process that we're trying to achieve by packing a wound. We are trying to get enough other material into the wound so that as we apply downward pressure, once the wound hole gets full, it's full, we can apply downward pressure to that wound. We're actually applying pressure inside onto the artery. Now notice in the drawing, you're sticking your fingers in the wound. If it's a big wound like this, and it's an arterial bleed deep inside, and all we're doing is putting the gauze over the top and it's not stopping, the blood just pooling up inside, we're not really taking care of that problem. Any questions? Okay. Then we go on to the tourniquet. Tourniquet, I know you guys have seen them before. They're a really simple device. They go on. All right, you can even put them on yourself. I don't know if you can see, my veins are already starting to pop out. That only took a moment to put on the tourniquet, all right? So you slip the tourniquet over the extremity, arm or leg. You put it 2 to 3 inches above a joint, so you don't put it on the elbows, you don't put it on the knees. You want to pay particular attention, especially people that have pants with pockets. If the injury is below mid-femur, you want to make sure that you're not putting the tourniquet over, the car keys or wallet or cell phone, because that's just not going to get the job done. So remove anything from the pockets. Ideally, you would be undoing the pants, you'd be pulling them down, or if you can't, you'd start at the bottom and you'd work your way up and you just rip that pant leg all the way up so so that you can get access to it. So the tourniquet, you tighten it down with the Velcro, you turn the windlass rod 2 or 3 times, as many times as needed until the bleeding stops. It's very effective, so 2 or 3 turns should do it. If you need more turns and you don't have any more room in your windlass rod, then you may have to put a second tourniquet on. The tourniquet, the windlass rod goes into the windlass strap, and then the strap goes over. You want to be sure to write the time on the strap. This is important because no longer is it a use it or lose it type of situation. Tourniquets can be applied for several hours without a patient necessarily losing their limb. Under 2 hours, it's not a problem. And here in the Valley, there are a lot of hospitals. You can certainly get to a hospital within a couple hours after applying a tourniquet. It to get proper medical attention. Physicians, they can take this off. They have proper medication to deal with it. Once you and I put a tourniquet on, however, we don't loosen it. We don't, just like we don't take the gauze off. We don't take the gauze off the wound here. We don't loosen the tourniquet to see if the bleeding has stopped. We sit there and attend to the patient. We make sure that the bleeding has continued to stop until somebody taps us on the shoulder and says, okay, I got this.
Michael, 2 quick comments.
Yes, sir.
Let the person know this is going to hurt, but that means it's working, and the time should be in either military time or AM, PM. So it's really clear if there's any confusion on what 1 o'clock means.
Yeah, very true. Thank you. And that is true. Tourniquets hurt a whole lot. I mean, so much to the point where, you know, you can say if they're not screaming at you, you're probably not doing it correctly. This is particularly true when you need to know this. So if you're addressing the needs of a spouse or a child and a parent or other spouses there, you know, they're going to be beating on you to take that thing off because you're just killing their kid, killing their spouse. You've got to take it off. You don't take it off, it really does hurt. If you have a tourniquet, I encourage you to try it on yourself, not to the point where you where your limbs are turning green, but try it and you'll see just within a matter of moments, the tingling sets in, then your limb will get cold. And if you don't stop after that, it starts to hurt, and it happens pretty darn quick. All right. And as Mike pointed out, you do want to make sure that you indicate AM or PM or military time. Ash?
I'm a CPR instructor, one of several on this call today. And I just want to say that my mom joke for tourniquet use versus CPR is along the lines of, you know that you're doing a tourniquet right if the patient is screaming at you. You know you're doing CPR wrong if the patient is screaming at you.
There we go. Yes.
Yes,
thank you. Yes, and Ash, just for clarification and a reminder, why, if the patient is screaming at you when you're doing CPR, why is that wrong?
Because they should be completely dead when you're doing
Okay.
CPR on them.
Thank
You're trying
you.
to reverse the death.
Yes,
Yeah.
you're doing CPR and they're screaming at you, that means they are alive. Thank you very much for that reminder, Ash. Okay, so even quicker review. We can do tourniquets in extremities. We can apply pressure. We can pack the wound. An armpit, neck, and groin. We can apply pressure. One thing you do want to be aware of when you're doing pressure on a neck, you don't want to apply pressure like this. That puts people into the sleeper hold. They pass out. You want to hand on the head, hand on the neck, and that will suffice. And again, the core, we don't even touch. So bleeding in children, all except the, little itty bitty babies, in very small children, you usually aren't going to need a tourniquet because their limbs are so little. We can usually apply enough direct pressure ourselves to act as a tourniquet. So we don't need the tourniquet, though they can be used if you had to. And the same, you would treat a child the same with packing of wounds. I won't go through these unless somebody wants me to answer them. These are questions that I get all the time. Let me point out, these are skills that you can use, well, the packing and the pressure that you can use on your pets. If you are going to do it on your pet, I strongly encourage, if not insist, that you have a muzzle, because even your most loving and kindest dog, you start putting pressure on a wound and they are going to turn right around and bite you because they are not going to like it. Any questions about my questions? Okay. All right, this did go quick. Remember, your safety first, call 911. You have to find the source of the bleed. If you can't see it, you don't know where it is. You apply pressure, pack the wound. If those don't work, then we go to tourniquets, and whatever we do, we're gonna wait until help arrives. We're gonna make sure that bleeding remains stopped. It's a little bit like triage in that we don't just do it and walk away. We do it and we sit there and we wait with the patient. If we're applying pressure, we keep that pressure on. We don't let up. If the wound was bad enough that you had to get on top of that person, get on and straddle them and apply pressure, then you are just going to wait for the fire truck or ambulance to show up. So that's all I've got here. Any questions about stopping the bleed?
Yes.
Yes, sir.
What about quick clot?
I thank you. I touched on that briefly. That's Hemostatic Dressing.
Okay.
Quick Clot is a brand. Hopefully that the gauze that you are packing into a wound, that's a hemostatic, has a hemostatic agent on it like Quick Clot. It goes in and it makes, it helps arteries, any bleeding. It helps to sustain, to stop the bleeding much, much faster. So that's a great product. They are expensive, and I encourage you to have one in every first aid kit. Other thoughts, questions? And, you know, I've been looking at you all morning and you just haven't moved.
Mike,
anything else?
Mike, you said you're going to give us the 800 numbers?
Oh, yes, I will. I'm going to email that to you because it's a pretty big list for everyone in the county. So since you've all registered, I will email it to everybody right after this class. Okay, when we're through here this morning. I will make a list.
Static agents, they do have a expiration date.
Thank you, Mike, for pointing that out, as do all medical supplies other than, well, actually, even just plain gauze, they put a date on it. All things like that do have an expiration date. So yeah, you're right. Do be cautious. Make sure, rotate your inventory. Make sure that what you have is current. And actually, even tourniquets, while there's no date on them, depending on how they're stored, if you have them in your backpack that you use when you go on your hikes all the time, your day hikes, and your tourniquet is poking out the top and the sun is beating on it all day, after a while, it's going to degrade the quality of the material. If like this one, if you're using a tourniquet, if you just have to practice all the time because you want to become really proficient at it, the Velcro becomes a little less Velcro-y. If that's a word, it becomes a little less sticky. So everything that you've got, you want to make sure is current and usable. Anything else? Okay, Ash, we're going back to you.
Thank you for that, Michael. That was fantastic. And we will also send out some of those stop the bleed dates that are coming up that Michael will be teaching in that email, that follow-up email to everyone who is here today. So don't worry, we'll keep you in the loop. All right, let me share screen. If nobody objects, I would like to skip past the video tour of the Hayman Park specific disaster supplies, and we'll do that with the Hayman Park group later. Since we only have 2 or 3 folks from our group here, I don't want to bore the rest of you with that. But let's move on to if a major disaster strikes right after this Zoom meeting. We log off and suddenly the big one happens, right? What do? Let's just talk real quick about as CERTs. I don't want to have any confusion, regardless of which neighborhood you're in, of what you should do if that happens. So immediately following, let's use an earthquake, a major earthquake as our example. First thing you're going to do, if you're not okay, you can't go help others safely. So first you're going to make sure that your needs are being met, that you're unhurt, your group, your family unit, your whatever loved ones are safe and okay, in a good place. See what injuries you've got, if any, check area safety, utilities, check in with your out of area contact if it was a large disaster, like potentially, because that's where people are going to be looking to see if you're okay. Oh, you live in California? I heard there was no, oh my God, I can't get through to them. Oh God, you know, let your out of area contact know. Some social media sites like Facebook and things like that, if you Once you've done all the important stuff, if you want to go on there and they have a whole check-in, or you post, hey, I'm okay, just heads up to people, it'll probably cut down on the number of crazy phone calls you receive or voicemails you have to go through later, maybe. But just know that. So first get your small circle, your immediate circle handled. Once you've done that, this says specifically to text George or Ash with your status. Change that to text your group leader, your neighborhood leader, with your status. Do you need help from them and 911 isn't responding at the moment? In that case, your co-leaders, your leaders will try to figure out a way to get you the help that you need. You're letting people know, right? But call 911 first if you need that kind of help, clearly. Are you able to be activated and to respond to the rendezvous point to set up a command post? Or are you not able to do that? You have too much going on in your circle. Let your leaders know that and just say, hey, I'll check back in when I have something else. If you're in the Hayman Park area and the Hayman Park team, turn on your radio and monitor channel 41. We did a practice on the Zello earlier today. You can also turn on your Zello app, but beware that it will eat up your battery. So don't just leave it on and have it activated the whole time, or a cell text message, and listen for radio traffic. So any of those three things, if you have access to even one item that will help you do one of those three things, then you'll be able to stay in the loop with your team with CERT, and we'll let you know if we've got an activation number from the city. If Campbell Police sends that out, then we will forward that to everybody else and we'll give you directions on what to do. That's what I believe all the leaders will probably be doing, is that they'll get the notification and they'll disseminate it to the team. And then at that point, check in with your immediate neighbors as you feel safe to do so. You're going to want to have your head on a 360, because especially if in our example of an earthquake, we've got aftershocks, we've got houses that may have moved on their foundations, we've got roofs that may be ready to collapse, we've got walls that may be coming down, chimneys that may tumble, power lines overhead in a lot of these areas. So constantly be looking around you. Do not get complacent. The point about in a big disaster is you do not want to become the victim. You want to make sure you're still able to help people. So always protect number one so that you can keep on helping everyone else. Okay, that's the big part. And if you forget everything else, nothing is working properly, your cell phone got shattered, your radios weren't charged, crap, but there's no doubt this was a true disaster, or you strongly think it was, and you're all squared away safety-wise to the best of your ability, report to the Hayman Park Clubhouse to rendezvous with the team. And I will say, even if you're not in the Hayman Park CERT team, feel free to meet us at the clubhouse if you don't know where else to go, okay? We will help sort it out. We'll get on the radios with your team. We'll help figure it out, all right? We're not gonna turn you away in a major disaster. So there is that. All right. Quick Zoom poll, if we could, to see what the retention level was on what we just talked about.
Okay, I'll launch that now. Here we go.
Thank you, Michael. Give me 5 more seconds. Oh, who's my holdout? 14 of 15. That's awesome. I'm so happy. All right, cool. You're confident we know what to do. You probably already knew what to do. It just makes me happy to see that that reinforcement there. All right, moving on to our Hayman Park's 2021 PEP Bites 5-part mini-series. In an effort to help with the community outreach, the non-CERT trained community around us, not just Campbell, but our areas, we're connected to a lot of parts of the South Bay. We are putting on 30-minute personal emergency preparedness bites, like just quick highlights, pretty much every other month, starting March 20th, for what to do in case of a disaster. So for instance, our first one here, earthquakes, it's going to be just quick highlights reminding people what to do before, immediately during, and right after a major earthquake, because it's been a little while since we had a big one. And if you're a transplant to California, you may have so many resources, you don't even know where to start with getting ready. And if you've been here all your life, maybe you've gotten a little complacent like some of us, thinking, well, it's been so long, you know, but I think a lot of us know, we feel this shadow coming up behind us, that it's gonna happen again. So that's just our geography. So that's what's gonna be, that 30-minute March 20th earthquakes. And again, our target audience for these PEP bites is non-CERT trained people, because we want to get our neighbors around us at least to get disaster preparedness on their radar. Because everyone, we've got pandemic fatigue, we've got Zoom fatigue, we've got so much going on, trauma and psychological first aid needed everywhere, right? It's been a crazy last, let's say, 16 months. And so at the minimum, right? So if you could please reach out to your neighbors, we'll include this link as well, the Eventbrite registration that you see there on the screen. We'll include that in the email to follow up as well. Please just text it to your neighbors, tell them, hey, just 30 minutes, all right? And this is all based on, we didn't just pull the curriculum out of our heads. That was an edit there. We pulled it out of the 3-hour Santa Clara County Fire Department preparedness, personal disaster preparedness curriculum, as well as Listos California's Disaster Ready Guide. So these are vetted major sources that are going to hopefully be very helpful in just waking people up again. And like I said, it's going to be pretty much every other month. Our May PEP bite is going to be on public safety power, what's it called? Power shutoffs, public safety power shutoffs. Yeah, for the safety of the public, they're shutting off power. So the PG&E turning off the electricity, that could happen to us during the summer, even though we live in a place where we think, we'll never burn up. And, you know, Santa Rosa, perfect example, Coffee Park. So PSPSs happen during super hot days, potentially. So we're going to talk about ways to prep for that and to make sure that you're handled if you lose your power for 12 hours or 24 hours or something like that. So please, again, share this link with your non-CERT neighbors, friends, coworkers, and that'll be happening at 10 a.m. on March 20th. In closing, please, I'll add the link in the Zoom chat, or I'll probably even more likely put it in the document that we email to you guys after this, the whole thing. Go on to the campbellcert.org training, website, and log your training hours. Just campbellcert.org, I believe, and you scroll down until you see training survey, and you just, all you put is like, you answer 3 questions, pretty much 3 or 4 questions.
We'll put the link, Ash, we'll put the link in the email.
Oh, perfect, thank you. So just log the hours, because every time you do something for CERT, it's awesome. It helps us with grant writing to show that we have participating members. People are active, they're involved, they want to be prepared, they want the information. So so the people say, oh yeah, we'll give you money then. That's what we want to keep on being able to provide training and buying these these supplies to prepare. So, all right. Another thing about funding, remember, go on the Campbell CERT Facebook page, even if you create a profile on Facebook just for this, and make sure that when you see a post pop up, in fact, any post since January, correct, Michael?
Yes.
You can love it or care for it. If you do any of the ones that have hearts, it makes it spread faster on the Facebook algorithms. Comment on it. Remember, on the Campbell CERT Facebook account itself, not somebody else who'd already posted it necessarily. And then share it if you're at all inclined to, because when you do that, you get the word out. And for a particular grant that we're trying to fund right now, for every heart reaction, share, or comment that we get on those, we get an amount of money. I think it's $20 every time, which is mind-blowing, but they're doing it for us. So let's just, this might be the reason they don't do that ever again, but we want to make sure we cash in what we can for our disaster supplies, right?
Teach them a lesson, is that what you're saying?
What was that?
We're going to teach them a lesson?
They'll be so shocked that social media actually worked.
Right.
So, but it's helpful tips that we're posting on Campbell CERT Facebook anyway. It's stuff about, make sure that you've, attached your bookcases that are over your head in your bed, attached them to the wall, because we live in earthquake country, wake up, stuff like that. So at this point, I'll ask if anyone has any questions about anything from today.